by three local doctors to discuss COVID-19, its Delta variant, and vaccines, as we're now 18 months into really navigating the impact of this pandemic locally. First, we have Dr. Nicole Florence, who spent 2 decades working as a local primary care provider and is now the director of Memorial Weight Loss and Wellness Center. Thanks for being here, Dr. Florence. And we have Dr. Christopher Smyer, who is a family medicine physician and the director of Diversity, Equity, Inclusion for SIU School of Medicine's Department of Family and Community Medicine. Thanks for being here, Dr. Smyer.
Thanks for having me.
And we have Dr. Brock Phillips, who is a pediatrician in Chatham with HSHS Medical Group. I appreciate all three of you being here today for this important discussion about COVID and everything that we've been going through as a country, a world really, but especially you guys as doctors being really in the trenches throughout this period of time. Before we really get started, I'd like to provide each of you with an opportunity to share a question you've received recently as it relates to this pandemic, the Delta variant, and vaccines that really stands out to you that you would like to address just to get us started here. And I will start with you, Dr. Florence. No pressure. You've got the floor.
Well, thank you. I think probably the biggest question that I typically get nowadays is about the vaccine. And the question I get is it safe? It seemed to have come out so quickly. How can we trust it? So I try to give a historical background in that we kind of thought a pandemic may happen at some point. And we've been working on this technology really since 2010, more specifically when you look at the mRNA vaccines we have, more about 2014. So I try to remind folks that we've been working on this for quite some time. And what we just needed really was that little piece of code or information for whatever virus was going to possibly cause a pandemic, get it in that vaccine, and we just happened to manufacture the vaccine while we were testing it, which is something we don't typically do with vaccines. So I try to go through that historical perspective so people will understand we just didn't come up with it out of thin air, so to speak.
Dr. Smyer, I'll let you go next. Is there a question that really stands out to you that you'd like to start with that you get a lot?
Yeah, so I also do prenatal care, and I know a lot of our pregnant patients have a concern about will this vaccine impact their future child, the pregnancy itself, and sort of trying to do what's best for both them and their child. And I just want to let people know that we actually have data now for women who were pregnant when the initial studies were being done. That was like a year and 9 months ago, and the women and their children are all perfect and healthy. And also we have data from women who got vaccinated once it was authorized and open to the public. And we haven't seen an increase in complications to the pregnancy. And we also seen that when mom makes those antibodies, he passes them on to their baby. So your baby can be born with some protection against COVID.
Absolutely. And Dr. Phillips, I know, you especially right now with the return to school, anything from parents that stands out to you?
Yeah, I would kind of agree with the sentiment raised by Dr. Florence and Dr. Smyer that parents are often wondering, is the vaccine safe for their children? It was first approved in adults and or under emergency use authorization. And Pfizer has since been fully approved by the FDA, but we are still under emergency use for children ages 12 to 16. So I think sometimes, parents may have questions of whether, their child should get the vaccine or is it safe? And I do agree that it's important for children to get vaccinated, and I do feel that it is safe. It has been well studied, and we are continuing to look for any unexpected side effects or we have a system in place to keep monitoring as we give more vaccines. And it does appear to be safe and effective. So I do support it and recommend if your child's old enough to get the vaccine, I do support that they get it.
And just to set up this conversation from a local perspective, as of yesterday afternoon, when Sangamon County reported the latest numbers, it put us at 12 COVID-19 fatalities for September. And, you know, we're not even halfway. We're at almost the halfway point in this month. And just for perspective, the county has reported in a single month, the last time we've reported this many fatalities in a month was January, when we reported 43. Prior to that, it was December when we reported the most fatalities in a month, and that was 60. So we're reaching numbers that we really, in terms of fatalities, that we haven't seen since really the height of this pandemic. The difference being, though, at that point, the vaccine was not available, and now has been more readily available to kind of people since, you know, April, the last 4 months or so. As you know, with these spikes in cases with the Delta variant, are there misinformation or misunderstandings that you have seen that have helped contribute from a local level to some of these increased cases and, you know, hospitalizations and, unfortunately, in some cases, deaths that we've seen? Again, we'll start with you, Dr. Florence.
Well, I think when we look at the numbers of who's being hospitalized, who is more critically ill, and as you talked about the deaths that we've had recently, the majority of them are unvaccinated folks. And we are, I don't know, you guys may have to correct me if I'm wrong, I think we're like 51, 52%, I think, in Sangamon County. So still not where we need to be. And I think there is a lot of misinformation. I think you are correct. I think people are anxious. I think they're scared. So it's really important to have conversations like these with trusted medical professionals that are local. We tend to see those national conversations, but people don't really know those folks. You know, here are physicians that are taking care of your grandparents, your kids, your babies, you know. So I think the more we have these local conversations with folks that we trust, hopefully we can get some more folks vaccinated.
And just from yesterday's data for Sangamon County overall population, we were at 53.95% vaccinated. And of course, as it relates to the people that aren't vaccinated, people have a myriad of reasons for not being vaccinated. I know one of the things, Dr. Smyer, that you've done research on is health disparities, and people have very real fears as it relates to past experiences family members have had when it comes to medicine and science, or just things that they've read about data and health disparities. What do you say to those people when they come to talk to you or when they ask you questions about or express some of those fears to you?
I think it's important that we acknowledge the real history of medicine, medical care in America, and medical care towards minoritized individuals. And so trying to acknowledge that it would be reasonable to have questions and doubt, but that's all the more important for you to have that conversation with me or with whoever their PCP is to talk about the medical benefits, the potential risks, because in medicine, nothing is 100%. And so we can't say you do this 100%, you're going to be fine, no risks or side effects. And so what that means is we have to be educated and informed, and you have to have someone who really understands your full medical history to be able to help you weigh those risks and benefits so that hopefully the benefits will outweigh the risks. I think oftentimes we do have family members or friends who may have had a negative side effect or a negative reaction. And so we anchor in on that one example and one experience that we know of personally without having the proper context of, hey, they may have had that negative reaction, but that's one in several thousand or several hundreds of thousands. And so being able to talk to your provider to say, hey, does this make sense for me with my health risks? You know, I have asthma. I'm worried about having an asthma exacerbation. Should I get vaccinated? The answer is yes, because your asthma makes you more vulnerable if you were to be infected. And so having that conversation to really look at the risks, the benefits of what we know and don't know, is how we can minimize patients being taken advantage of, because patients should be informed about their health. They should be informed about what we are recommending, and they should understand why it's in their best interest.
Absolutely.
I would add, if I could, and Dr. Smyer and I actually got to do a health fair this past Saturday, a men's health fair at Union Baptist. And I would also say I will commend our community leaders as well. And I know I love my mom and I tell her to talk to her doctor, but it's her Delta sisters that probably also influenced her to, get vaccinated and do those things, our local churches, our pastors. And so, we can also rely on our community leaders within those minoritized populations too.
Absolutely. And in just preparing, to have this conversation with you guys, I asked, a number of people that I'm aware of that aren't vaccinated and said, hey, why did you make this decision for you? And a response I got back from more than one person was, I'm healthy. My children are healthy. We trust our immune system to do its job. And so, for us, we feel like our immune system will do our job. As it relates to the wider community, we trust that, in social distancing and using a mask, that will help protect other people from getting sick that may have underlying circumstances that may put them in a worse situation. Dr. Phillips, what would you say to those people that express to you? I know you said you're someone who supports the vaccine, but if somebody says, hey, this is where I'm at, is this okay?
Yeah, I think, there's questions about, do I need the vaccine? I'm healthy, or my child is healthy. He or she does not have asthma or a chronic condition. But that's the tricky thing about COVID is we don't know why some people are very sick after they get COVID, and they may have been perfectly healthy before, never had to be hospitalized in their life, but there's just no way to know for sure. And if there's something that you can do to, help prevent it, or even just lessen the severity, studies have shown that having the vaccine can at least make it less likely for you to have those very severe complications where you need to be maybe on a ventilator, or children also can get a autoimmune response to the COVID infection. And, again, we just don't know exactly who that would happen. And it's a rare complication, but, we want to do our part to, try to prevent that. So I still agree that getting the vaccine can help, even if you are perfectly healthy and you have a strong immune system.
And Dr. Florence, as someone who, often works with people that may have underlying conditions that may make them worse off, what would you say to other people that kind of take that stance, and the impact you've seen that maybe someone who is perfectly healthy, it wasn't a horrible situation for them when they got it, maybe nothing more than, a traditional cold, but the impact it had on someone else because they came in contact?
So, at my population at Weight Loss and Wellness, managing obesity with associated conditions like diabetes, high blood pressure, sleep apnea, heart disease, our population is very high risk. So I have those conversations with my patients a lot. And the way I try to explain it to the healthy, as well as maybe to the unhealthy, is that, yes, we hope your immune system responds the way it should, but we are all going to be tested by COVID. This virus is just running rampant, and not one of us is going to probably be able to avoid it at some point. And if you are going to be tested by COVID, you just want your immune system to have all the information that it needs to properly protect yourself. And so, a vaccine doesn't replace your immunity. I think that's what people kind of think about. It just enhances your immunity to act more accordingly to whatever it's coming in contact with. So I try to explain that to people, that we are all going to be tested. I like to pass tests. I don't know about y'all, but I want all the answers to the test. So give me the vaccine so I can pass that test more accordingly.
And one question I got from a number of people was, how do I know if I should get the COVID-19 booster now? And I know that's something that's not readily available to everyone now, but as it becomes more available, how would you guys advise people to make that decision?
So I think as we get closer to a overall official decision being made with formal guidelines and recommendations coming out, then it'll be a matter of talking with your primary care providers to know, sort of based off of the formal guidelines and recommendations, where do I fall in? Which category do I fit into? At this point, we do recommend it if your immune system would be considered weaker or not necessarily able to function as best it could, whether that's because of immunosuppressive medication that we're giving you to force your immune system to be a little bit weaker because of your other health conditions, or if you have a health condition that weakens the immune system by the very nature of that condition, such as HIV, we're recommending you to get that third booster shot if you got Moderna or Pfizer, so that your immune response will hopefully be more equal to the immune response of someone who had a healthy immune system. The vaccination basically gives your body a way of amplifying the number of antibodies that it's making, so that if under normal circumstances you would make 100,000 copies of these antibodies, but if you're immunocompromised because of medications or condition, you may make only 80,000 instead. And so we're trying to get them up closer to people that are otherwise healthy so that they can really pass that test, as Dr. Florence was just recommending and talking about. I think another really important thing within the context is that oftentimes people say, I got through the first wave of the pandemic, fine, I'll be fine this time around. And the reality is the first time around, we had a lot of rules, regulations, shutting down to make it easier for people to actually truly maintain a bubble and not engage. But because things are staying open, kids are back in school, kids are sort of continue to be in contact with people. They don't control their environments as much as we can as adults. And so your overall risk and exposure is just a lot higher, such that just because you could get through under the old rules, there's new rules. So that can't be taken as a true same test. We're just doing it again. This is really a different context and a different risk profile because people are engaging with each other at work, at school, and kids are interacting with each other and those sorts of things.
Absolutely. And I want to leave some time for some of these other questions. So we'll start to get into them. We'll see how that goes. This one doesn't have a name, but it says, I've already had COVID-19. Aren't I immune? Why would I need the vaccine? So whoever would like to take this one, go for it.
Well, I had COVID, so I will take that one. And it was horrible, people. It was horrible. It took me like 2 to 3 months to recover, to be at my full capacity. And I did get the vaccine. It was out thereafter. And what I try to remind people is we don't know how long your immunity is when you've been infected, right? We can't test your blood work every single day to see when your immunity starts going down. So we think it's anywhere between 3 to 6 months, but everybody responds differently. Also, you really don't know which COVID strain that you were infected by. So the strain that you may have been infected by at some point, you might get infected by a different strain. So you may not have that protection. So I always tell people, you don't want a gap in your immunity. When you get cleared with your COVID infection, go ahead and get your vaccine. That will just cover any possible gaps of those antibodies dipping down, and then you may be being exposed to the virus again. So we always recommend even though you've had COVID infection, still get your vaccine.
And Dr. Phillips, as you know, Dr. Smyer even just mentioned, with the return to school, we had the state fair. We're more out in the environment than we were early on in this. At the same time, the CDC has said the Delta variant is more than twice as contagious as previous variants. So in terms of that, when people kind of reference making it through some of this and they've been fine until this point, what do those conversations look like, knowing both this current variant that seems to be different than previous variants, but then also the realities of we are not social distancing at the same level that we were maybe a year ago?
Yeah, I agree. The Delta variant is definitely more contagious. I think we know that now, and it just puts more emphasis on those things that we can do to help what we call mitigate or kind of decrease the risks of spreading it or catching the virus. So things like washing your hands frequently and wearing your mask when indoors, and especially for kids, I think in school, it is really important. That's kind of the first line of defense, if you will. It's preventing, if a child has symptoms or had a runny nose, for example, that mask is still preventing a lot of those droplets from getting into the air to the children around them. And then obviously vice versa, that there's a filter when you're breathing in to help filter out some of the other particles that could be in the air. So, the schools are, I think, doing the very best they can to keep it as a safe environment for children. As a pediatrician, I do support kids being in school. There's a social aspect to it, obviously, and you can imagine a bunch of 25 kindergartners on a Zoom class. It's just not going to be as effective, as far as their learning as being in person. So with that being said, there is still, there's going to be a risk of spread. And I have seen patients who have had COVID. So following the recommendations from the school or the nurse, if maybe there was an exposure that if they ask you to quarantine, I would follow those recommendations, watch for symptoms. And if your child's sick, having symptoms like fever and cough, it's a good idea to get them tested. That way we can know what's going on. And if it's negative, we can maybe get them into school a little bit sooner if they're doing better. So with that being said, it's definitely, there are more cases. I did have a little graphic that I was going to show you. You kind of touched on there have been more deaths in the last month in Sangamon County. And I also just printed this. This was actually from Friday, but I thought it was a decent graph. It just goes to show you, I can get it here. This is the number of cases that we've had in Sangamon County. This is the last several months. At the front here is April 1st. So as you can see, as we go up, this is the number of cases increasing. So we are in a how do you call it, a surge, but we have a wave, if you will, as you've heard that in the news. And that's mostly due to Delta virus. The admissions have gone up significantly in patients, both for adults and pediatrics. But another point that we touched on is over 3/4, at least the most recent information I had from yesterday at St. John's, that over 80% of those who are admitted did not get the vaccine. And then out of 39 patients in the ICU, 35 of them did not have the vaccine. So only 4 out of 39 did have the vaccine. So it's, I'm more a visual person and kind of I like numbers. So it gives you a sense of the protection that you can get with the vaccine.
One of the other things those numbers have shown over the last month have the people that have died have been younger. We had our first death in the 20s in Sangamon County this month. Last month, we had 2 deaths of people in their 30s. Those were the second and third deaths, confirmed deaths in the county since the start of the pandemic. And so as this has kind of creeped up in this other wave, we've also seen it impact people that are younger. So as we are going back out into school and we are seeing increased cases, how do you advise people, Dr. Florence, in navigating the balance of this is going to spread and I still need to go to work and that's okay, versus kind of that fear of, well, if this is as bad as they're saying it was, then why are we out? Why are we not at home? Why are we not doing the things that we were doing when we were in January and December?
Yeah, that's a hard one, right? Because I know, especially us in the healthcare community, we're getting nervous. We're getting very nervous. Our hospitals are filling up again. And we can only take so much as a health system. They're already kind of all burned out. I try to encourage people they have to remember what you can control. I can control myself wearing a mask. I can control myself washing my hands, being distanced. I can control myself being vaccinated and choosing to be around other vaccinated people. So you do have some control, I think, that will kind of help us get through this wave or this surge. Because I think when the anxiety and the fear starts to kind of get higher and higher, I think that's when we start to lose sight of what we really can be doing each day. And if we're all of us are doing that, we maybe don't need as many mitigations as we did before. And I think that's where we are as a community is, hey, if you get your vaccine, wear your mask, do the right thing, maybe we won't have to close down and do all of those things. So whether or not that is coming, I don't know. I don't have any special information or anything, but I just try to remind my folks that, hey, there's so many things that you can control to make sure that you don't get sick and that you protect those in your home.
Is there advice that you pass on, Dr. Smyer, to families when they say, a number of people at my work have gotten sick or haven't felt well, or our case numbers for my children's school has been up lately? When they ask, should I keep them home or should I just make sure that they keep washing their hands and wear a mask? What do you tell them in terms of that?
So I sort of tell everyone it's sort of their own unique situation. I had one patient who had really bad anxiety, and that was sort of the trigger and the source of the anxiety, this fear, and she had other health conditions. And so for her, we ended up starting to write a letter for her to work from home, get her plugged in with a therapist to sort of process and talk through that and build some coping skills. She's vaccinated, she's done everything, but the big thing for her was that her boss is also vaccinated and got sick. And so for her, having that time to work with a therapist and sort of reduce some of the triggers that she's experiencing each day made sense for her overall health. For others, it may not make sense for their overall health, or they may not have the luxury or the type of job that would allow for them to be able to work from home. And in which case, then we talk about making sure that they're vaccinated, making sure if their kids are older that they're vaccinated so that everyone has as much protection as they can, so that if they were to be exposed, they sort of are minimizing the risk of severity. I think oftentimes people may get fixated on, like, I might get COVID. But the thing that I'm more worried about is, are you going to be one of those people that is going to have severe symptoms, be in the ICU, on a ventilator, and potentially die? And if I can do things to at least make it that you're not having to be hospitalized if you were to get COVID, then I'm more okay and more reassured that you're going to be able to get through this pandemic alive. And so sort of helping people to understand that while it's possible you may get it, vaccination, social distancing, wear your mask, wash your hands, will minimize those risks. And that vaccine also will give you that extra protection. If you were to be exposed and were to get COVID, you're now more likely to have minimum symptoms that may not even require you to be hospitalized. And if we can keep you out of the hospital, then we're less worried about you getting really sick, because we only want people really sick in the hospitals. And we have really sick people in our hospitals. And that's the scary part, is that everyone in our hospitals are really sick and need to be there. and we're running out of beds. And so being vaccinated reduces the likelihood of you getting really sick, which means we can keep you out of the hospital, which means we can keep you alive and get through this pandemic.
Okay, so really just playing it by ear, depending on both maybe your mental health state, your immune system, and if you have any of those predisposed conditions, and the vaccination status of people around you and yourself. It sounds like you're saying kind of a combination of those things. The next question we have is from April, who says, are our local hospitals best equipped to handle the critical COVID care of patients better off seeking treatment in a larger metropolitan area where there may be more COVID resources?
So I'll start with that question. I think the capabilities of our hospitals to provide appropriate care, we do have. And whether you're in our area or a larger metro area, it's more of, are there beds available? And so we may know what needs to be done. We may have some resources to do those things and actually provide that care. But if we only have enough resource for 5 people, we now cannot best serve those 5 people. And the system that we have within hospitals is that if a hospital has someone and they're not best equipped to meet those needs, hospitals are talking together to say, hey, can I move and send you one of my patients because we don't have the resources to best provide care. And so it's not so much of a urban or more metro area having more resources, it's just availability. And what we're finding is that availability is going down everywhere. It's going down faster in places where less people are vaccinated because those who aren't vaccinated are more likely to be sick and be hospitalized. And so if everyone is getting vaccinated, then it reduces that strain so that people can go to their local hospitals and get the care that they can provide because they have the resources available to provide that care.
And I just to add on that too, I do think, as far as our local hospitals, are they well equipped to deal with COVID or sick COVID patients? I do feel that they, have a lot of emphasis and, preparation to help deal with the pandemic. I agree there's going to be days where numbers might be a little tight or, bed status is always evolving. But, I do have confidence that, that the local hospitals here can help take care of patients who are needing that care.
Dr. Phillips, has there been a particular challenge for you that you faced in the return to school and just navigating conversations between families about their children?
Yeah, I would probably say a common frustration. Sometimes I would say maybe teachers or nurses or staff, they're very diligent about watching for any kid who may have some type of symptoms, whether it's a runny nose or cough or, so a lot of kids do get sent home if they're having symptoms and are asked to be seen by a provider to be sure, is this COVID or is it not, which would be kind of up to that provider to figure out, or if they needed a test. So I think sometimes that's hard for parents to maybe get a phone call that, they had a runny nose today at school and needed to be picked up, which again can cause stress or strain. But I think most primary care providers are equipped to see those type of issues and figure out how to get them back or get them tested. So I think as far as, is that a common thing lately that we've dealt with? But I think, again, the schools are really doing their best to try to keep all the kids safe. And I think most parents also understand that, maybe they just had an ear infection or maybe they had a sore throat because it's strep throat. It's not from COVID. So, there are other diagnoses, but, just try to bear with the schools as they're doing the best they can too.
Absolutely. And I just want to remind everyone, we have about 10 minutes left in this conversation. If you're watching on Facebook, if you want to drop questions in the chat there below, you're welcome to do that. We'll try to get it in here in the last 10 minutes. But as people come up with some of their final questions, I just want to provide each person with an opportunity to explain what they hope that people from the community walk away with from this conversation and as we move forward together as a community in this next phase of the pandemic.
Well, I've been in Springfield, well, basically all my life. I stayed home, did SIU School of Medicine. I've been practicing here a long time. And my hope is, I know we are all focused kind of on our individual health, but I always have to remind people that my health is also dependent on your health. And so we really have to bind together as a community. And if we can get those vaccination numbers higher, if we can really be good about those masks, I think that we can prevent a possible storm that's headed our way. And we always talk about personal rights and the individual, which I understand, but COVID is a different thing because my health is really dependent on all of your health. So we really have to start thinking about each other as well as ourselves. So I'm hoping as a community we can kind of get this figured out.
Okay, and I'm gonna get in some of these questions that are coming through. So not to cut anyone off, but we have a question from Lynn who says, should we get the flu shots before the booster vaccine is available?
I would get the flu shot as soon as you can because that just protects you against the flu or the specific strands of flu that are covered in that vaccine. Any protection you can just reduces your overall risk of that sort of being something that's going on. And one of the things that we have to realize is that if you get the flu looks a lot like COVID. And so we don't really have a good way of distinguishing the two. And so if we can reduce your chance of getting the flu and getting infected with one thing, that's going to keep your immune system healthy enough to fight off if you were to be exposed to COVID. And so the more protection you can get, the better. I wouldn't be waiting or delaying one to try to time it for another one that's not even out or available yet. And always, when in doubt, talk to your primary care doctor. That's what we are here for, to help you think through those questions about what makes the most sense for you and your particular health concerns and needs. And so bring in all the questions and concerns, and we can have an appointment just to go through all of that so that you are really informed about what's going to be in your health's best interest.
And then another question from Lynn that says, if someone has not been vaccinated, even with a mask on, should we not let them in our homes?
That's a personal choice. I think the reality is if someone is not vaccinated, they are a higher risk that if they had an exposure, they were going to get COVID. And they're a higher risk of, if they have COVID, passing it to others. And for some people, COVID looks very clear and apparent. They can't taste, they can't smell, they feel miserable. But for others, they don't have those symptoms and they otherwise seem and feel okay. And so if you are not comfortable with the idea that they could give you COVID, I probably wouldn't bring them in my home. If you're comfortable with, like, if I got it from them, I would be okay. I'm not going to be too angry at them. Then invite them into your home. But that's going to be a very personalized choice.
Absolutely. And Dr. Smyer, while you have the floor, I'll let people know what you would like them to take away from this conversation as we move forward.
I would like for people to know that all the questions you have are legitimate because this is your health, your children, your family, your community's health at stake. And so don't ever feel hesitant to bring those questions to your primary care doctor so that we can go through the information to say, hey, this makes the most sense. Or we can say, hey, here's a known risk, but I think this is a tolerable risk given the alternative. And so being able to have those honest conversations are very much welcome, because I know that means you're actively engaged, actively thinking about what's in your best interest, and we'll make an informed decision at the end of the day, which is what we want for all of our patients.
Absolutely. And Dr. Phillips, what would you like people to take away from this conversation especially the families that have children right now that are in school.
Absolutely. I wanted to echo Dr. Smyer, who, put it very eloquently that, we as primary care providers, we want to help our patients and our families, as a pediatrician, the entire family, to understand on an individual basis what their risk factors might be, or what their family situation is, or what their concerns are. No question is, we want to hear any question, essentially, whatever you have, or if there's something that's bothering you, any concern, it's okay to bring up, or make an appointment to discuss in detail, or call the office. We want to help, and we want to help answer those questions. So don't be afraid to reach out to discuss further, if you on an individual basis, or have a further discussion.
And we have a question from Mary here that says, I do know someone who had COVID, then got the vaccine a couple weeks later. He also got the second vaccine, but since receiving the first, he's been experiencing brain fog. Is it best to wait longer after having COVID to get the vaccine?
Well, I think the general recommendations, again, it's a personal choice, and depending on your symptoms, some people do want to feel a little bit better. But the general recommendation is, once you are out of your isolation after COVID for 10 days, you can get that vaccine anytime from then on. In terms of, other symptoms from COVID or the vaccine, it's variable. So you would have to talk to your provider. If you're still having some long-term symptoms or you have concerns, then maybe you two can discuss the vaccines, the first and the second shot. But the general recommendation, CDC says, after 10 days of isolation, you can get your vaccine.
Absolutely. And again, we have 3 minutes here, and we have more questions coming in. So I will ask them until we run out of time. So continue to send them. Sorry if we don't get to them. The next one is from Christine, who says, what would you say to the public to explain why these vaccines are safe, even given the fast tracking, quote unquote, to educate people who don't know or understand the science behind the vaccines or the FDA approval process? And I know off the top, some of this was explained. So for people that came in late, or just if you want to further kind of explain that a little bit.
And one of the biggest differences with these vaccines, and most specifically the mRNA, there's no virus in that vaccine. I think people kept saying, but you're giving me coronavirus. No, there's no actual virus in those vaccines. It's just kind of communication. It's a code that tells you how to respond when you come in contact. Although J&J, I think, uses a little adenovirus, which is not going to harm you, and puts a little protein spike on it. They're safe. They're not necessarily been fast tracked. We've just kind of cut some of that bureaucracy and the big time gap between producing the vaccine and studying the vaccine. So in terms of safety, we have vaccines that we've done similarly in the past that are very same science, same studies. So we haven't really changed how we do science per se.
And I'll toss this one to you, Dr. Phillips.
Yeah.
I assume they're talking about people under 12, but Mindy asks, when can kids be vaccinated? I don't know if you've heard anything beyond under 12.
Yeah, there are studies that are currently underway where kids between the ages of 5 and 11 are getting the COVID vaccine. They are continuing to enroll more kids and look at that data closely to make sure, again, that it's safe and effective, and that would be with the Pfizer vaccine. But we don't have an exact date of when that may be approved for emergency use. My hope is that maybe by the end of the year, but again, we just don't know for sure yet. But just to reiterate, if your child is 12 or older, kids between the age of 12 and 16, they are able to receive the Pfizer vaccine.
And we have officially hit our 45-minute mark. And so I want to thank all three of you, Dr. Florence, Dr. Smyer, Dr. Phillips, for joining me today for this conversation, for answering questions from the community, and having this important conversation during what has continued to be a difficult time for many families among us. But I know you guys are all busy, so I will let you get back to your lives and your jobs. Thank you so much for all you do, though, in our community.
Okay. Thank you, Natalie.
Thank you. Bye, guys.
Thank you for having me. Take care.